A unique knowledge base and the means to communicate it are requisite for a profession. Nursing continues to be deeply involved in developing its own unique knowledge base and in educating students about it. In identifying this base, various concepts, models, and theories specific to nursing have been recognized, defined, and developed. This PowerPoint will include just a few examples of nursing models and theories that can be applied to the patient population discussed in this course. The self-care of heart failure model was developed by Barbara Riegel to be used with heart failure patients. According to Barbara Riegel, the definition of self-care used within the heart failure self-care model is that self-care is a naturalistic decision-making process involving the choice of behaviors that maintain physiological stability and the response to symptoms when they occur. There are three main components of this model. With self-care maintenance, this includes when a patient takes their medications as prescribed, follows their diet regimen, engages in exercise, and is monitoring their symptoms. Self-care management occurs when a patient recognizes that they are having symptoms of heart failure. They're able to evaluate their symptoms, respond appropriately, implement a treatment, and then evaluate whether or not that treatment has worked. The third concept, self-care confidence, is the confidence to engage in these other two concepts, self-care maintenance and self-care management. The transitional care model, designed by Mary Naylor, targets older adults with two or more risk factors. This can include a history of recent hospitalization, multiple chronic conditions, or multiple medications, and poor self-health ratings. The major goal of the transitional care model is to help the patient and family caregivers develop the knowledge, skills, and resources essential to prevent future decline and hospitalization. The nurse's role is to promote continuity of care, communication with the primary care providers, and promote a commitment to self-management. Uncertainty of illness theory was developed by Merle Mischel. Uncertainty is a constant occurrence when living with a chronic illness. Uncertainty decreases over time and returns when there is an illness recurrence or exacerbation. Uncertainty is the most distressing to a person during the diagnosis phase. This is the place where healthcare providers can lessen the uncertainty on a patient by educating the patient about the illness, showing confidence in treating their illness, and giving the patient clear and concise information. Within the uncertainty of illness theory, uncertainty is defined as the inability to determine the meaning of illness-related events occurring when the decision maker is unable to assign definite value to objects or events or is unable to predict outcomes accurately. The theory is composed of three major themes. Antecedents of uncertainty includes anything that occurs prior to the illness experience that affects the patient's thinking, such as pain, prior experiences, and perception. Appraisal of uncertainty is the process of placing a value on the uncertain situation. Coping with uncertainty includes activities that are used in dealing with the uncertainty. According to Afaf Melis, who developed the theory of transitions, the nature of transition can facilitate or hinder a person's pattern of response. The theory of unpleasant symptoms was developed by Elizabeth Lenz and Linda Pugh. Unpleasant symptoms are defined as the perceived pointers of alterations in the normal body functions that a person experiences. There are three main components within the theory of unpleasant symptoms. This includes the symptoms that a person experiences, the influencing factors that cause or have an effect on the symptom experience, the outcomes associated with the symptom experience. The components interact with one another and influence each other. Symptoms can result from a single cause or can be viewed either alone or in combination. Situational, physiological, and physical factors have an influence on the symptom experience.